The PRovoke Podcast, brought to you by PRovoke Media and produced by the international broadcast specialist Marketeers.
Welcome to the PRovoke Media Podcast. I'm Megan Keoghan, Head of Content Partnerships here at PRovoke and host of today's episode with We Communications. As we enter a new year and are no longer focused solely on what initiatives brands are committing to internally, the focus has shifted now to how they engage with consumers and the values that they are perceived to have. With this shift, it's become increasingly apparent that consumers are turning to brands that contribute to the societal good. What does this mean for biotech and pharma? Here today to speak with us is Ben Fisher, Head of Health UK for We Communications. Ben, so nice to have you.
Megan, thank you so much. Pleasure to be here.
Absolutely. Our pleasure indeed. Can you tell us a little bit, just intro background primer here, what your role is at We and a little bit about the Brands in Motions initiative?
Yeah, absolutely. So I work in the UK office, but I'm part of the global healthcare team here at We Communications. So We does a lot of work with corporate purpose-led communications. We work within tech, we work within health, and a lot of what we do is kind of on that intersection. And I head up the team in the London office for communications, healthcare communications, PR and media, and also the educational side, so medical education and scientific engagement. So a lot of what we do is focusing on the healthcare professional and how they perceive the brands of both the products that they use and the companies that create them. So it's really fascinating for us to look at the perception of this kind of critical audience. And that's where this iteration of Brands in Motion comes in. So Brands in Motion is the annual survey that we run here at We Communications. It's in its 7th year. So 100,000 plus people, business decision makers, consumers have been asked questions, been interacted with. And it's all looking at this perception of brands. So, you know, how do companies thrive in a world where everything is in motion? You know, the expectations, the perceptions of brands are shifting and they're changing. And last year, we did our 2002 Brands in Motion survey. And, you know, it's really interesting looking at some of the things that have stayed the same, some of the things that have moved on. So, for example, the cost of living crisis, you know, leapt to the top of, you know, something that brands were looking to and expected to address, especially with their internal employees and their internal staff. There was a hefty dose of kind of skepticism out there with regards to purpose-led communications and how you demonstrate that you're living your value. And there was a growing, I think, expectation that brands were looked to with regards to provide stability, and that those that were doing it well, you know, it affected the bottom line. Corporate communications makes a difference. And so that's what we wanted to do. This was really interesting. And we looked at some of the differences between the different sectors, and we were really keen to do a deep dive within specifically the audience of healthcare professionals. So this new data is, out today, and we have looked specifically across key markets, and we are asking the question: to what degree does corporate communications matter to healthcare professionals?
And it's exciting because this is, I think you may have mentioned it, the first time that We has actually focused or brought the shift onto this particular category when you in releasing a Brands in Motion study.
That's right, and it's exciting for us because we've been able to kind of move specifically and more deeply into a healthcare specific sector. So, you know, big societal changes, trends, they make a difference wherever you're working. But sometimes you need to be aware of that and then really look at your key audiences. And we saw a tendency for, you know, kind of hints that expectations were a bit higher among HCPs, that they were perhaps more demanding in their expectations of brands. And I think traditionally, healthcare professionals, because they are, they're scientists, they're clinicians, they are data-driven professionals. So how much can corporate reputation really matter? I think we have a sense that it does, that it could and it should, but we really wanted to ask that question. And top line is that it does matter, and it matters a lot. It's both a driver and a barrier for the equivalent of what would be a purchasing decision. It's a prescribing decision. So beyond the functional characteristics of medicines, which are always going to come first, innovation and being able to talk about your data, being able to demonstrate that innovations in treatments work, that they're safe. Of course, they're always going to come first. But once you look beyond that, the reputation of a company is really important, and it's really important for healthcare professionals.
When we talk about reputation or how that brand perception applies specifically to pharma, biotech, I can understand as a consumer why trust and reputation matter so much. Like discussing healthcare products, deliverables. Any one of us who's ever been a patient is hoping that our healthcare provider is choosing the brand that they trust most. But what are some of the ways that trust is exemplified, or what are some of the ways that you've seen through the Brands in Motion study that demonstrated? Is it through giving back to communities? Is it through relationships of meeting providers in their offices? Is it through like the pro bono work that they're doing with their Medicaid? Is that anything that this study has covered?
It is. We've looked kind of broadly across, I suppose, three key themes. So some of the things that some of the initial data looked at what was a driver for prescribing decisions, and for being open to partnership. Because I think that decision is the first part of a partnership. So we know that corporate reputation is it matters, and it matters a lot. But we also know that 2/3 of the HCPs asked said that reputation was a barrier. So if they thought badly of a company, it would affect how much they wanted to engage with that company and how much they would likely to make a prescribing decision. So it's not just a nice to have. It's not that you do the core work well and then you kind of put a polish on with corporate reputation. We know that it is an active driver and that it can act as a barrier, and so it affects the bottom line. That's the key point. You definitely need to talk well about your products. You definitely need to educate effectively. You definitely need to be open, but you do need to have a corporate reputation that is seen favorably to maximize what you're trying to do in a business point of view, but also what you're trying to do in terms of your mission and your value. Like pharmaceutical companies and biotech, what they're trying to do ultimately is deliver innovation in medicines and treatment that makes a difference to a patient's life, makes a difference to health outcomes and a lived experience for people. And you can only do that when there's an open two-way dialogue and you're thought of well and you're seen well. One of the key statistics for me was that just over 70%, 73% of HCPs asked believe that pharma should be adding value to society beyond innovation in medicine. So there is an expectation there to do more from a societal, from a community point of view. And asking the question a different way, there was 9 in 10 expected that the support that pharma and biotech provided should go beyond just delivery of the treatment. So there's an expectation from like an individual point of view. So I think that what we did see is we saw that those expectations for doing more and doing more good beyond your core offer, whichever sector you're in, they were even higher within HCPs. They really do demand this. It's not it's not something that is just you can leave as a second hand. It's something that's really important. And I think that's a real challenge. It is medicine at its heart, but it's more than medicine. We have to do more.
Yep, absolutely. And for anyone who is sort of learning about brands in motion today for the first time, or specifically this practice at can you just briefly share with me, how did you go about finding those who were interviewed for this? What was the methodology about gathering all of this feedback and sourcing the healthcare providers?
Yeah, absolutely. So it's part and parcel of an ongoing commitment to looking at brands. And this specific health pulse, the aim is that we are able to keep really flexible and explore in a specific way areas that are going to be relevant to health. So this is about finding healthcare professionals and allied healthcare professionals, and it was over 1,000. It was Australia, China, Germany, India, the UK, and the US. So what we did is we partnered a research company, Sapio Research, and we invited them to an online survey and interview. And what we're doing is we're asking them a number of specific questions that all revolve around the impact, the expectations of biotech and pharmaceutical. So it's really, really really rich. It's really kind of robust evidence, and it's allowing us to kind of take quantitative and qualitative research and insights specifically around our key target audience.
And having had the privilege of getting to review this and see this information firsthand, there is so much to digest. But I would have to say it's done in a really consumable way. Lots of data points, lots of key takeaways. And just to let our audience today know that this is available on We's website, and also through PRovokeMedia.com. They'll be able to download this report and leverage it in their own practice and applications.
Absolutely. And one of the things that we do know, one of the things that's absolutely certain, is that things are changing all the time. Politically, things are they're always in flux. It's always dynamic. We're still grappling with what the impact is from COVID and the pandemic and subsequent lockdowns. It's highly relevant, obviously, across all sectors, but also within within healthcare specifically. And we saw a big jump in kind of expectations and a halo effect after the pandemic for pharmaceutical. Names and companies that no one really had heard of unless you worked in the industry were now kind of most recognized brands on the planet for a short period of time. And it's how does that change things? And that's an open question. But what we want to do is maintain that kind of halo effect, but also rise to the expectations and meet the opportunities that are now available for the wider healthcare sector. So this report and making this available is us being one voice in an ongoing debate about and discussion about how can we essentially do what we're trying to do, which is communicate effectively, offer the best service to our partners, our clients, so that we're doing justice to the health innovations that they're bringing. And it's all about improvement of health outcomes. Fundamentally, that's what we're trying to do, and that's part of the debate that we want to take our part in.
It's a lot of data, and it's really fascinating data. I'm so curious for you personally, Ben, what were some of the most surprising takeaways, or were there any kind of tidbits that just either caught you off guard or were different than what the hypothesis might have been?
Yeah, I think taking a step back, I think having worked in pharmaceutical communications for over 20 years, I think that we've seen such a pace of change that when you see it in kind of black and white, it always used to be data led. It was always about the numbers, because essentially our proof lies in data, in efficacy of data. That's got to be the root cause of it. And so there's certainly been, over the years, a big shift into, a much broader expectation with, value and mission, and doing things beyond your, I suppose, your lane, And I think that's a really interesting tension and a really interesting question for companies and brands to look at, because you can't do everything, but it's quite clear that there is an expectation to do more than your core offer. So I find that a real challenge, and I think it's really fascinating that it will continue to be a tension. There's never going to be one right answer, because these things move on and they change. And then I found one particular element that leapt out from the data is that, the work that still needs to be done. So with regards to patient centricity, the idea that the industry has moved away from being disease centric, so just kind of looking at the science and looking at this, to, more person centric, is, something that has been talked about for years, and all, pharmaceutical companies and brands have a different way of articulating it. But it was quite clear that the majority of healthcare professionals surveyed in this Brands in Motion data, didn't really buy that it was being done absolutely well. So there's a challenge, there's an opportunity. 55% said that patient centricity, wasn't being done. It wasn't being done that well. It wasn't being done optimally. And that's a kind of big challenge, because this is something that we have been grappling with and looking at for a long period of time. So it's quite clear that there's work to be done. Slightly less than half is not something that the industry can rest on its laurels about. There's great partnerships happening, but how do we really demonstrate patient centricity? How do we demonstrate that the experience of individuals who will be taking medicines and on medical treatment, how do we demonstrate as an industry that their experience is central to what we're doing? And it's quite clear that we need to do more, and we're expected to do more.
Would you say, it seems to me that correlates a bit with something that you said 2 thoughts ago regarding how the pandemic, or like post-pandemic, has really shifted the spotlight on a pharma and biomedical companies. Consumers are paying a lot more attention. They've never paid attention or used brand names in a household way. And would you say that shift sort of correlates with that demand or call to a higher accountability to be more patient-centric?
I think probably it shines a greater light on it. I think that the expectation from healthcare professionals that we should, as an industry, be and demonstrate patient centricity, I think that was there before COVID. But what it does do is it allows greater awareness, is a larger platform to speak from. So there is more possibility to do more, and also greater expectation across society. And I think that the takeaway from this, with 45% of HCPs believing that pharmaceutical and biotech companies are to a great or larger extent, is less than halfway. So what we want to do is we want to do more. We're not delivering on the patient-centric promise, and we know that it is one of the most important expectations. It's core to the industry. It was up there in terms of the number one characteristic that HCPs wanted the industry to embody. So it was 64% put it right at the top, followed by quite a drop down in terms of in the early 40s of being innovative and progressive. And I think that's been a really big shift over the years. You might suggest that it's all about data and it's all about innovation, which obviously you have to do those things, but there's a much greater expectation now that we should be leaving with it. So it's the biggest expectation in terms of the audience, and it's the one where there's most skepticism that we're not delivering on. And that's through really complicated, it's a complex environment. It might be through comms, it might be through the way in which it might be through activities. But it's good to know that this is a real challenge, and this is an opportunity for us.
You've been able to spend a lot of time in this data while aggregating it and synthesizing it. And I know that your work with your clients has also not stopped in that period. And I'm very interested in hearing from you about some of the early applications of the learnings that you've taken away from this and how you've been able to apply that to any of your clients or your work at We.
Yeah, absolutely. I mean, it's part of an ongoing I suppose, challenge to improve. There's things that are done really well. I mean, there's anecdotally, I've been over the years, I've been part of perhaps medical advisory boards that are highly technical and only talk about the data. Mm-hmm. And then I've been part of them where you invite patients, patient groups in, and really frame every question around the individual. And I think that type of activity is really important, and demonstrates your aim to be as patient-centric as possible. And then some work that we've done recently as part of this team with Boehringer Ingelheim is, I think, a really great example of corporate reputation building that is embodied in behavior and what you're trying to do, that fits perfectly alongside your kind of brand of the product, but is beyond that. So it's in the area of air pollution, and Boehringer Ingelheim, who are a client at We Health here, we coordinated and launched the integrated care clean air framework. So the idea is this directly addresses the threat of air pollution at health access points, so hospitals and GP surgeries. And it's a way of trying to highlight a big issue that obviously Boehringer Ingelheim are innovative in because of their scientific innovation, their research and development. They have effective medicines within respiratory that make a really big difference to patients. But what more can and should a company be doing on a corporate level? So this is an excellent example of a partnership, between the integrated care system, between a hospital in Newcastle, between pharma, between comms expertise. And the aim is to raise awareness of the importance of air pollution and the effects that it can have on patients with respiratory outcomes, and to provide something that is going to make a difference. So it positions us as kind of leaders. It's socially important because we know that worse air pollution disproportionately affects people on lower socioeconomic status. So it's not just a health issue; it's also a societal issue, but it's rooted in improving health outcomes within respiratory in a way that's much bigger than a single product. And I think it makes a difference. It's a demonstration of real partnership. I think that's the type of work that goes beyond the single brand, and launches into something that's more powerful, that shows that industry can be a real partner.
I think it does that particular case study, and I'm so glad you brought it up, brings light to the example of how the that delivering on the accountability to a social good, it really requires strategic thinking about the multiple ways that it's connected across societal. So we're talking about the air, we're talking about marginalized groups, we're talking about access to care, and it's really linking all of those and sort of connecting that story or the red thread throughout all of these components that make a brand more valuable to the common good, or more involved in all of society.
Yeah. And we saw that from one of the quotes was a clear expectation of pharma and biotech to increase access for marginalized groups, and that's a completely different thing for innovation. It's delivering innovation, and then it's making sure that it gets to the right places, and it's absolutely key it's absolutely clear that that's a key expectation.
What of this information and the what you've been able to do with BI and what you are doing with your ongoing clients, of the data that you've been able to work with, what are you most excited about moving forward from what you've learned?
I think it's really given the permission to counsel clients and to work with clients to do as much as we can to get that balance right between product and corporate communications, because we often the bulk of the focus, maybe the investments, the worry is about specific products to begin with, because without a deep pipeline, pharma can't continue to do what it wants to do, and what that does is it can often put that too much to the forefront. So as an agency, you might join at the launch or just before the launch of a new specific product, and that can mean that everything focuses that, but it does need to be a balance. And HCPs do want to receive product information, but they also want to kind of have transparency more into the workings of that larger parents company, that corporation. And we asked some questions about relative importance, about what do you want information for. We asked the question, tell me about would you like tell me about your product. Is that what HCPs are saying to us? Tell me about your product. That's product information, that's clinical data, that's side effects. Help me do my day job. So that's just a step back. So there is a product, but how can we help educate patients? How can we have support in place and resources that will support that? What are the core medical education to make sure that these things are understood? And then we said, what about telling me about your business and how you're making a positive impact? And that final question was 43% compared to help me do my day job of 33%, and tell me about your product, which is 23%. So even though that it's important, it's still very easy for the industry as a whole to be tunnel visioned and focus on a specific product. And I think that says that we need to do all that we can to broaden our demonstration of how we live our values, how we do more than just medicine. We need to do that at every point, every point that we can. And I think that's really exciting, because I think that is a challenge. And it stops you from kind of going back into, just kind of more typical and more standard ways of communicating.
Yeah, the safe or the default way of approaching to what we think is the most important message. This really
Yeah.
validates moving forward in other parts of the conversation. Did the report that you've put together, and apologies if I've missed it, but have we talked much about how to measure that sentiment or the effectiveness of these shifts in marketing and messaging along the way, moving away from tell me about your product to show me how, talk to me about my patient. In a year from now, how will we look at that conversation to measure its effectiveness?
Yeah. Well, I think being, even, massively optimistic, these things are way more than, a year's work. It's always a challenge to measure perception. And obviously you can do it through, very specific based sort of quantitative market research, which is one thing. And you can do it through anecdotally and a sense of how partnerships are growing, how much do we feel that we're delivering more than medicine, that we're getting it right, that we are that we're putting the patient experience at the heart of everything. But I think what this does is, depending on what program you're doing, depending on whether it's highly technical and educational or whether it's raising awareness for patients, how you measure this will be different. But I think how I will use this report is making sure that these things are embedded right up front in terms of how we will demonstrate success. So it wouldn't we should never ask the question in terms of understanding of new modes of action of new innovations without asking questions about patient centricity, without asking broader questions about how the company is viewed, its favorability as the holding company. There's a really interesting tension between that. Are you a house of brands or are you a branded house? And I think that I think it's particularly interesting tension within pharmaceutical products because products often only are only utilized in one therapy area, and that might be the only touch point that a healthcare professional has. But there's still a halo effect from the broader company. We know that. So it's important never to do the one without the other.
Absolutely. And as we start to kind of think about, okay, we've looked at this data, we've have it at our fingertips. What ways would you recommend companies use these insights that we're looking at? How do we put them into action?
Yeah, and isn't that the key challenge for everything like this? I think there's a myriad of ways, but what we try to simplify it into kind of some key takeouts. One was deliver more than medicine. So we know that corporate reputation matters, and we know that we need to and have permission to do more. And so we should look for that next step. The other was this idea of knowing your company's kind of place in the world. So you need to go beyond R&D and marketing treatments, and you need to make sure that any value add is communicating your purpose, and it builds on what your core offer is. The other one is about looking in the mirror. I mean, so specifically talking around patient centricity. I think sometimes, I think that it's a challenge. It's a challenge to think that half of or more than half of the audience kind of perhaps don't think you're walking the walk. HCPs want to know that you're doing the right thing. They want to know that patient centricity is the very, very heart of what you're doing, and that you're actively listening and that you're actively communicating with patients. And I think that's the type of thing that can get lost. And I think even if you're doing it, I'm sure there's many examples where it's done well, but perhaps we're not showing it. We're not showing it as effectively as we might be. So making sure that that's key to communications is really key. And then I think it's about getting the basics right. We know that it's broad. We know there's an expectation to go broad in the aspiration to do more and to have a positive effect on society and on the environment. And it is an expectation, but of course, what comes first is the core healthcare challenge that you're trying to address. And the innovation, and when you can link the two, and they don't sort of float around separately, that's when it's really, really, really powerful. I would advise people to kind of this idea of transparency. You need to make it real. That was the takeout from the broader Brands in Motion survey last year. It's absolutely fine to kind of talk about work in progress, to show kind of a bit of mess. We tried to do something. We're going to do this. HCPs want to know, what you're doing the business for, what the purpose is. We don't need to be overly polished. What we need to be is completely authentic, and aim to do better, and to kind of live that purpose. And that's partly about kind of leaning into this idea of proof over promise. So, words, yes, they're important. Aspirations, they are important, but they're nothing compared to proof, to doing things and showing it. And we know that because healthcare professionals are so data literate, and that they demand proof, that also translates into corporate communications. So kind of having lofty and worthwhile ambitions, will only resonate if you can show what you're doing, if you can demonstrate that what you're doing is making a difference. And then I think finally, this idea of, ensuring that you find a voice that's distinct to you. We are in a sector where it's easy to say you're patient-centric. The industry has talked about innovation for a long time. But the challenge is to stand out. The challenge is to do things and behave in a way that's distinctive, and to tell a distinctive story, and to find a voice that's kind of truly yours. And I think from a comms point of view, that is, the best that you can do to highlight the purpose and the vision in action.
So many things to think about and be excited about as we move forward with this kind of information. And from your 2 cents, a parting thought, I'm very interested to hear, what does 2023, 2024 and beyond look like if we properly apply these learnings? As a consumer, how does the biotech and pharma landscape look different in our experience? Your thoughts on that?
So I think we know that things won't be settled, but whatever we do, this is going to remain in flux, and we want to be part and parcel of that conversation. But the more relevant that pharma brands can be to the day-to-day patients and broader carers, society, that they can be, that they are the brands that they talk to or they look to for information, for support. When we do that more and when we do that effectively, that's when we know that we have a healthy reputation. That's what we're looking for. It's knowing that it's not just about communicating efficacy and data. It's more than that, and it's more than medicine. It's about supporting people, supporting society, supporting the professionals of the healthcare professionals to deliver the best care, and to produce access, to enable access for as many people that will benefit from the incredible rate of innovation that's happening within the industry.
More than medicine, supporting people, supporting society, and supporting access to care. All really wonderful things for us to aspire to. Thank you so much, Ben Fisher, for summarizing this, for putting together this information. parting thoughts from you? Anything else that we've overlooked?
Just a big thank you to have the opportunity to talk about it. This research will be available, and it's going to be a living, breathing conversation. We'd love to hear more. There's other areas we could look at. It was it's a challenge, kind of only being able to ask certain amounts of questions, and immediately, if we were looking again, next month, there'll be different and interesting questions to answer that will hopefully, provide new challenges and a different nuance for the way in which we communicate. So we're not doing it again in a month, but we definitely are excited about doing it again, next year. And Brands in Motion will continue to evolve and continue to try and reflect the changing expectations that audiences have, for communications and marketing.
Well, thank you so much, Ben, for bringing this tool and resource to all of us. Again, listeners can find that through the link on our website, PRovokeMedia.com, and also on We Communications website. I do encourage people to look it up. Lots of really interesting takeaways on there, and certainly things that we can apply to all of our practices. So thank you very much, Ben. Great to have you.
Thank you so much for your time.
And this has been the PRovoke Media Podcast.
You've been listening to the PRovoke Podcast, brought to you by PRovoke Media and produced by the international broadcast specialist Marketeers.